Hello, in this video, I will be presenting my video assignment on phlebotomy.
The name of the institute is Qualitas Training Institute. My name is Mary Junor. Lecturer's name is Miss Veterving. Date of submission, August 31st, 2021.
Introduction. Define phlebotomy and state functions of a phlebotomist. Phlebotomy is the removal of blood from the body by making a puncture in the vein, usually in the arm. The procedure itself is known as venipuncture.
Phlebotomy is both a technical and people-oriented profession. Responsibilities of an phlebotomist. 1. Prepare patients for collecting procedures associated with laboratory samples. 2. Collect routine skin puncture and various specimens for testing as required. 3. Prepare specimen for transport to ensure stability of sample. 4. Maintain patient confidentiality. 5. Perform quality control checks while carrying out clerical, clinical and technical duties. 6. Transport specimens to laboratory. 7. Comply with all procedures instituted in the procedural manual. 8. Promote good relations with patients and hospital personnel. 9. Assist with collecting and documenting monthly workload and recording data. 10. Maintain safe working conditions. 11. Perform appropriate laboratory computer operations. 12. Participate in continuing education programs. 13. Collect and perform point-of-care testing known as POCT. 14. Perform quality control checks on POCT instruments. 15. Perform skin tests. 16. Prepare and process specimens. 17. Collect urine drug screen specimens. 18. Perform electrocardiography. 19. Perform front office duties. Current procedural terminology, coding and paperwork. Phlebotomy is performed to A. Obtain blood for diagnostic purposes and to monitor prescribed treatment. B. Remove blood for transfusions at a donor center. C. Remove blood for therapeutic purposes such as treatment for polycythemia disorder involving the overproduction of red blood cells.
Phlebotomy is primarily accomplished by one of two procedures. 1. Venipuncture, which involves collecting blood by penetrating a vein with a needle and a syringe or other collection apparatus. 2. Capillary puncture, which involves collecting blood after puncturing. Equipment and supplies routinely used by phlebotomists. 1. Phlebotomy chairs. 2. Equipment carriers. 3. Phlebotomy carts. 4. Gloves and glove lines, small, medium and large. 5. Antiseptics. 6. Disinfectants. 7. Hand sanitizers. 8. Gauze pads and cotton balls. 9. Bondages. 10. Needle and sharp containers. 11. Biohazard bags. 12. Slides. 13. Pens, permanent. 14. Watch or clock. 15. Vein locating device. 16. Tourniquets. 17. Needle, multi-sample, hypodermic and winged butterfly. 18. Safety features. 19. Evacuated systems. 20. Tube holders. 21. Syringes. 22. Syringe transfer device. 23. Syringe needle. 24. Various tubes, additive and non-additive. 25. Stoppers. 26. Anticoagulant. 27. Laboratory label printers. 28. Blood drawing trays. 29. Goggles. 30. Gowns. 31. Bed. 32. Table. 33. Trays. 34. Requisition forms. Sites for venipuncture. The preferred site is the antecubital area of the arm. Other sites include median cubital, the dorsum of the foot, the scalp and the medial ankle.
In this video, is a clip of me doing a routine venipuncture for a blood donor.
Skin puncture sites include the middle and ring fingers for adults and older children, the heel for infants and younger children. However, venipuncture of these sites requires special training and permission of the patient's physician. Needle gauge: 1, 15 to 17. Needle type: special needle attached to a bag. 2, 18. Needle type: hypodermic. 3, 20. Needle type: multi-sample. 4, 21. Needle type: multi-sample. 5, 22. Needle type: multi-sample. 6, 23. Needle type: butterfly.
Needle classification. Needles are classified according to gauge and length. The gauge is the inside diameter of the needle. The lower the gauge number, the larger the inside diameter will be. For example, a 15 gauge needle is used for blood donation to allow the blood to flow freely through the needle and to decrease turbulence and damage to the red blood cells. An 18 to 22 gauge needle is used for intramuscular injection in adults. A 27 gauge needle is used for an intravenous line in a premature infant. The inside diameter of a needle is also known as the bore. The term bore is synonymous with gauge, but the bore is designated only as either small or large. A butterfly needle is a specially designed needle of short length and high gauge, with color-coded tabs of plastic on each side of the needle. These tabs facilitate control of the needle during insertion. This needle gets its name because the tabs on either side of the needle make it appear like the wings of a butterfly. Butterfly needles are most often used to start intravenous lines on premature infants or on elderly patients with poor veins.
Typical use: 1. Collection of donor units, autologous blood donations, and therapeutic phlebotomy. 2. Used primarily as a needle rather than for blood collection. Safety issues have diminished use.
Typical use. 3. Sometimes used when large volume tubes are collected or large volume syringes are used on patients with normal size veins.
Typical use. 4. Consider the standard venipuncture needle for routine venipuncture on patients with normal veins or for syringe blood culture collection. 5. Used on older children or older patients with small veins. Syringe draws on difficult vein. Typical use. 6. Used on the veins of infants and children, also on difficult or hand veins of adults. Components of the evacuated tube systems are: 1. Multi-sample needles. 2. Tube holders. 3. Evacuated tubes. Components of the syringe tube system are: 1. Syringe needle. 2. Syringe. 3. Syringe transfer device.
In the images shows as follow: the evacuated tube system and the syringe system.
In the image are as follows: 1. Types of vacutainer tubes. 2. Stopper colors. 3. Additives. 4. Functions of additives. 5. Departments used by each. In the image are listed the order of draw and the rationale for venipuncture and capillary puncture collection order.
More commonly used blood bottles and blood tests. It's intended to help you understand which bottles are used for which tests, so that you can choose the appropriate equipment when you land on the wards. We're trying to give generic information, but don't forget equipment and protocols may vary between different trusts. The purple top bottle is used for haematology tests. The most common of these is the full blood count. This includes hemoglobin, which is an important investigation in numerous scenarios, including blood loss. Platelets, which if depleted can result in increased bleeding risk. And white cell count, which is typically increased in infection. The purple bottle is also used for other tests, including HbA1c, which is important in the assessment of diabetic blood sugar control. The gold top bottle is used for a range of biochemistry tests, including urea and electrolytes. This gives values for sodium, potassium, urea and creatinine, used for assessing kidney function and detecting electrolyte derangement, for example hyperkalemia. Other tests include liver function tests, C-reactive protein, bone profile, magnesium, lipids, thyroid function tests and cardiac enzymes. The same bottle is also used for various more specialist endocrinology, oncology, toxicology, virology and immunology tests. The blue bottle is for hematology tests to assess the clotting system. Coagulation screen includes prothrombin time, activated partial thromboplastin time and fibrinogen. INR is important for monitoring warfarin therapy, and D-dimers are useful in the diagnosis of deep vein thrombosis and pulmonary emboli. The grey top bottle is used for two specific biochemistry tests: glucose, which can be a fasting or a random value, and lactate, which can be raised in any condition causing tissue hypoperfusion, for example sepsis or acute ischemia. The pink bottle is used to send a blood sample to the transfusion lab for patients who may require a blood transfusion. Group and save or cross-match can be requested. Group and save determines and stores the patient's blood group, so blood can be ordered swiftly if needed. Cross-match refers to the process of ordering blood for the patient. Typically, the bottle must be labelled by hand at the patient's bedside after confirming the patient's details, but your trust will have specific guidelines which you should adhere to. Blood culture bottles are used to send samples to microbiology for culture, to isolate organisms and enable targeted antimicrobial therapy. Protocol varies between trusts, but you may be required to fill more than one bottle. Some trusts require 2 samples to test for both aerobic and anaerobic organisms. An aseptic approach is crucial to avoid contamination. All of the tests described so far can be performed on venous blood samples. An arterial blood gas sample is typically taken at the wrist from the radial artery. This test provides values for pH, oxygen content of blood reported as PO2, carbon dioxide content of blood reported as PCO2, bicarbonate, and basic cess. Arterial blood gases provide important information in acutely unwell patients to allow assessment of illness severity, clarify the diagnosis and guide management. This test is collected in specific syringes and must be taken to the lab within about 20 minutes of collection for accurate processing. We hope this video has improved your familiarity with the equipment we have discussed. Hospital labs are always happy to help, so don't be afraid to call them if you need any advice.
Components of a phlebotomy tray. A well-organized and well-stocked phlebotomy tray is every phlebotomist's best friend. It ensures that a procedure is carried out quickly and blood specimens are handled safely and properly. Components of a phlebotomy tray. The essentials are alcohol swabs, gauze squares or cotton balls, assorted evacuated tubes. Evacuated tubes are in order as follows: blood culture, coagulation tubes, non-additive tubes and additive tubes. Syringes. Components of a phlebotomy tray. Syringe transfer device. Various sized syringe and evacuated system needles, butterfly collection sets, microcollection equipment, tourniquets, disposable gloves, sharps container and marking pen.
Procedures for routine ETS. 1. Review and accession test requests. 2. Approach, identify and prepare patient. 3. Verify diet restriction and latex sensitivity. 4. Sanitize hands. 5. Position patient, apply tourniquet and ask patient to make a fist. Procedures for routine ETS. 6. Select vein release tourniquet, ask patient to open fist. 7. Clean and air dry site. 8. Prepare equipment and put on gloves. 9. Reapply tourniquet, uncap and inspect needle.
Procedures for routine ETS. 10. Ask patient to remake a fist, anchor vein and insert needle. 11. Establish blood flow release, ask patient to open fist. 12. Fill, remove and mix tubes in order of draw. Procedures for routine ETS. 13. Place gauze, remove needle, activate safety feature and apply pressure. 14. Discard collection unit. 15. Label tubes. 16. Observe special handling instructions. 17. Check patient's arm and apply bondage.
Procedures for routine ETS. 18. Dispose of used and contaminated materials. 19. Thank patient. Remove gloves and sanitize hands. 20. Transport specimen to the lab.
Procedures for venipuncture of a hand, vein, butterfly and ETS holder. 1 to 4 same as routine ETS. 5. Position hand, apply tourniquet, ask patient to close hand. 6. Select vein release tourniquet, ask patient to relax hand. 7. Clean and air dry site. Procedures for venipuncture of a hand, vein, butterfly and ETS holder. 8. Prepare equipment and put on gloves. 9. Reapply tourniquet, uncap and inspect needle. 10. Anchor vein and insert needle. 11. Establish blood flow and release tourniquet. Procedures for venipuncture of a hand, vein, butterfly and ETS holder. 12. Fill, remove and mix tubes in order of draw. 13. Place gauze, remove needle, activate safety device and apply pressure. 14. Discard collection unit. 15 to 20 same as routine ETS. Procedures for needle and syringe venipuncture. 1 to 7 are same as the routine ETS. 8. Prepare equipment and put on gloves. 9. Reapply tourniquet, uncap and inspect needle. 10. Ask patient to make a fist, anchor vein and insert needle. Procedures for needle and syringe venipuncture. 11. Establish blood flow, release tourniquet, ask patient to open fist. 12. Fill syringe. 13. Place gauze, withdraw needle, activate safety device and apply pressure. Procedures for needle and syringe venipuncture. 14. Discard needle, fill tubes, also discard syringe and transfer device.
Procedures for pediatric venipuncture. Collecting blood by venipuncture from infants and children may be necessary for tests that require large amounts of blood. Normally the most accessible veins of infants and toddlers are the veins of the antecubital fossa and forearm. Capillary collection is normally recommended for pediatric patients, especially newborn and infants up to 12 months, because their veins are small and not well developed and there is a considerable risk of permanent damage.
Procedures for capillary venipuncture. Capillary puncture have the same general steps regardless of whether they are finger sticks or heel sticks. The first 4 steps are the same as for routine venipuncture.
5. Position patient. Position is important for patient comfort and the success of specimen collection. 6. Select the puncture or incision site. General site criteria includes one that is warm, pink or normal color and free from scars, cuts, bruises or rashes. 7. Warm the site if applicable. 8. Clean and air dry site. 9. Prepare the equipment. 10. Puncture the site and discard the lancet.
11. Wipe away the first blood drop. 12. Fill in mixed tubes or containers in order of draw. 13. Place gauze and apply pressure. 14. Label specimens and observe special handling instructions. 15. Check the site and apply bandage.
16. Dispose of used and contaminated materials. 17. Thank patient, remove gloves, and sanitize hands. 18. Transport specimen to the lab.
Possible problem sites for venipuncture. 1. Burn scars and tattoos. 2. Damaged veins. 3. Edema. 4. Hematoma. 5. Mastectomy. 6. Obesity. 7. Arterial line. 8. Arteriovenous shunt. Fistula or graft. Possible patient complications and conditions. 1. Allergies to equipment and supplies. A. Adhesive allergy. B. Antiseptic allergy. C. Latex allergy. 2. Excessive bleeding. 3. Fainting. 5. Ask permission and explain what you are doing if it is necessary to loosen a tight collar or tie. 6. Apply a cold compress or wet washcloth to the forehead and back of the neck. 7. Have someone stay with the patient until recovery is complete. 8. Call first aid personnel if the patient does not respond. 9. Document the incident according to facility protocol.
References. Information have been gathered and researched from Phlebotomy Essentials 5th edition by Ruth McCall and Kathy M. Tankersley. As we come to the end of this presentation, thank you for watching.